Europejskie systemy ochrony zdrowia od ponad 10 miesięcy zmagają się z pandemią koronawirusa SARS-CoV-2. Z pomocą decydentom chcą przyjść również organizacje skupiające ekspertów i przedstawicieli branży farmaceutyczno-medycznej. Jedną z nich jest AmCham Europe, który przygotował zbiór rekomendacji, tzw. Recovery Plan, stanowiący propozycje dotyczące funkcjonowania systemów ochrony zdrowia po pandemii COVID-19. Dzisiaj naszym gościem jest pan Seán Byrne, prawnik, doradca AmCham Europe.
Thank you very much.
AmCham Europe prepared recommendation for policymakers about Europe after COVID pandemic. Why did you decide to prepare this document?
Yeah, so initially we were looking at a document prepared by the European Commission called the Repair and Prepare for the Next Generation. And a lot has happened since the publication of that document in May of this year. What we've seen there was the EU dealing with the fallout following the first wave of the pandemic. And the Commission recognized the duality of the situation that Europe faced. On the one hand, we had a health crisis in the form of COVID-19, and on the other, we had an economic crisis due to multiple factors, but primarily due to lockdowns across the globe and related restrictions necessary to curb the spread of the virus. One of the key healthcare priorities at that point was to increase the budget of the EU for Health programme. We've seen how this played out. Initially, the Commission proposed a budget of 9.4 billion. Then a smaller budget of 1.9 billion was proposed by the Council. And finally, we can anticipate a budget of approximately 5 billion euros. This is in contrast to a previous budget for the same programme of just 449 million for 2014 to 2020. We should see this as a huge achievement for Europe that will help by providing much needed funds to the healthcare systems to improve their infrastructure and resilience. Of course, at AmCham EU, a lot of time has been spent considering the long and short-term implications of the pandemic. Apart from the issues related to COVID-19, 2020 presents the end of the current EU budget cycle, so negotiations were already ongoing in relation to the next MFF, the budget of the EU that's going to run from 2021 to 2027. Our report, Investing in Europe's Recovery, Forging the Future, takes a holistic look at what Europe needs to do to recover from the pandemic. In addition to ensuring a strong digital and green transition, we foresee the need for diversification of supply chains to ensure that all citizens have continued access to medicine, food, and supplies necessary, regardless of there being a pandemic. But this cannot be achieved through economic nationalism and protectionism. We live in a world economy, and we must strive to work together globally. We also foresee the need for transatlantic cooperation. Ultimately, for our organization, it's important that our members' interests as international partners are properly considered. We represent some of the world's oldest companies, historically intertwined in Europe as much as they are in the US. The transatlantic economy remains the largest, most prosperous, most innovative of its kind in the world. It continues to grow. Aggregate US investment in Europe totaled more than 3 trillion euros in 2019 and directly supports more than 4.8 million jobs in Europe. Generates billions of euro income annually in income, trade, research, and development. So we believe the EU and the US need to continue to work together in the short and the long term to develop their economic ties and address the global challenges that we face. Of course, we also foresee the need for a global healthcare response to COVID-19, where Europe continues to present itself as a strong leader and facilitates international partnerships to beat the coronavirus. And we outline a number of recommendations for this to achieve strong European healthcare systems in our report.
Thank you. And what are the conclusions of the recovery plan? How should the health system should be treated by politicians?
So we believe that there's a number of long and short-term recommendations that are essential. COVID-19 has demonstrated the importance of the life science sector and the ecosystems that support healthcare research and innovation. Without the collaboration between European and US companies, for example, in the past 20 years, many of the vaccines and treatments that we now anticipate wouldn't be possible. The thing is that the pandemic has also highlighted our many weaknesses. And when politicians and other stakeholders in healthcare talk about resilient healthcare systems of the next generation, we believe these need to be able to react to a pandemic when it's necessary to do so. But we can't forget patients who suffer from chronic diseases such as cancer or cardiovascular disease or those are rare diseases. While dealing with the pandemic was and is of utmost importance, equally important is our ability to provide care to all patients. Those who need to visit the hospital for scans or operations, and those who need a continuity of care that simply has to be provided whether we're dealing with COVID-19 or not. To achieve this, we outlined some short and long-term goals. We firmly believe that we need to strengthen public health crisis frameworks. We can't have a repeat scramble situation that we've seen at the beginning of the pandemic. So Europe is stronger when we work together. Politicians, as members of the public, as stakeholders in healthcare, whether that's industry, NGOs, it doesn't matter. And to this end, AmCham EU welcomes the European Health Union initiative, and we really look forward to engaging on this. To ensure the success of this initiative, we believe in strong pan-European frameworks at local, regional, and international level. These are key. The more coordinated that we are, the easier it's going to be to implement all of our recovery priorities. We furthermore need more adaptive regulatory systems and thinking at the level of the EU in order to facilitate shorter approval times for vaccines, for new technologies, while continuing to ensure their quality and safety. We would call for increased administrative support at the European Medicines Agency. This will allow us to return to normal as fast as possible and get our economy back on track. Thinking more long term, we need to really rethink our models of care. Making our healthcare systems more resilient means ensuring that all patients receive the treatments they need, pandemic or not. Rethinking provision of care includes an increased focus on prevention, early diagnosis, and on keeping patients out of hospital by moving care close to communities. Ultimately, this is about ensuring the access and continuity of care I just touched on a minute ago. We need to capitalize on things like the digital transition to improve access to high quality interoperable data, drive innovation and research, and enable us to maximize the potential of our healthcare infrastructure. And lastly, we need to have a world-class IP incentives framework. The EU must ensure that an attractive IP system is in place that can underpin long-term investment in the life sciences ecosystem to incentivize European innovation for the benefit of all patients, but particularly those with rare pediatric and chronic diseases. We've seen how we were able to quickly turn around vaccines and other treatments for coronavirus, and that's due in part to the long-standing IP incentives that we've had in the past.
Do you see the response for your recommendation, or you didn't send all authorities this report? How it look like that? Do you see the response for this recommendation? Maybe.
Yeah, I think so. I mean, we engage a lot with different partners, obviously at the EU level, where AmCham Poland will deal with Polish national system and Polish politicians, for example. We're dealing regularly with the Commission, with the permanent representations of nations and member states. So in this sense, it's an ongoing conversation. There's a lot been going on. There's a lot of different consultations where we will pin our reports to and things like this. But in general, people are quite respectful and responsive to the reports that we make. It's, you know, at the end of the day, this is really important for us that there's good quality of content in the work that we do, and that we're offering thought leadership and offering a different perspective that takes into account this transatlantic relationship that we need to have, but ultimately, for example, in healthcare, that achieves the goals that we all share.